Morning everyone. Myself Dr. Rajveer Kaur. I have done my PhD in mental health nursing and I passed my nclexrn exam in 2023 from New York Board. I hope everything is good. Today I will discuss a very important topic with you that is frequently tested in RN exam, prioritization. So it will help you all to decide which patient you have to see first. I hope by the end of this session, you guys are able to learn that which should be the priority, which patient should I see first to save the life. So, let's begin. Very first, before starting, I have a question. Just imagine, you are a graduate nurse and you arrived at your unit by 7 a.m. in the morning. And you receive the lab values of 4 patients, the different 4 patients. The one patient has potassium 6.5, the other is hemoglobin of 7 gram. The third one has 120 molecule per liter sodium, and the fourth one has creatinine of 3.8 mg per dl. Now, what is the most important thing that will come to your mind? Who will you see first? Whom I can save from a danger condition. Most students immediately think that which lab value can be the most dangerous. They just start to memorize the things. But here's a secret to passing the NCLEX. The NCLEX is not a testing whether you can memorize lab values. It is testing whether you can recognize which patient is in the greatest danger. That is the most important one. So you should need to know the concept behind every lab value. Normal values we can remember, abnormal values we can memorize, but you should know the rationale behind high or low value. What can be the most dangerous to the patient? So in this scenario, if we think about 4 values, 4 are abnormal, but the most dangerous is potassium because that has a direct connection to the cardiac muscles. So next, before starting, you have to know the main ones, but also know which one are more danger than others. You need to know everything. You are watching, you are taking care of every patient, but you need to know which is more important than others. You should know how to prioritize patient according to the lab values. That is the main topic which we will discuss today. So first of all, I would like to ask why are lab values important? Why we think that lab values should be considered at every point? So patient may have an abnormal lab value, but still think about it, but still not be the highest priority. NCLEX frequently asks these things. Which patient will die first if you don't intervene at the right time? So if you don't know anything, just think the favorite one, ABC, airway, breathing and circulation, that directly connects to the safety of the patient. Then before we talk about the lab value, you must understand the most important NCLEX tool, ABC. That is the most common and most important and most studied from the beginning. Whenever you are unsure who to see first, ask yourself one question. Whenever you are feeling confused, you don't know which patient I have to see first, so just ask yourself one question: which patient has the greatest threat to airway, breathing or circulation? Who is at higher risk for any problem in airway, breathing or circulation? The patient with the most immediate threat usually becomes your priority. So the patient who is at high risk from these 3, that will be the priority of a nurse. So easy memory trick to remember this: ABC, air goes in, breathing keeps oxygen moving, and the circulation pumps blood. So these are interconnected to each other. No airway means no breathing means no circulation, and if there is no circulation, end of life. There is no life. So very easy to remember. If airway is open, then breathing is possible. If breathing is there, then automatically circulation is working and we are alive. So next, if we talk about the nclex, students think that they have to remember a lot of things because in study materials we have a lot of data on the internet related to nclex. We have lots of hundreds, thousands of books. But the main point is this: when you catch tics and tricks of nclex on the right time, then this is very easy to pass nclex in your first attempt. It is not enough to memorize normal lab values. The examiner wants to know which abnormal value is most dangerous and what action you should take. The examiner is just checking your critical thinking and your decision making by asking you that whom you will see first, who will die with an abnormal lab value. Every abnormal value is not an emergency. To make this easy, we will use the ABCD priority system. Whenever you see an abnormal lab value, don't panic. First ask yourself, what priority level is this? So I will teach you today, I will teach you a very easy way to remember all this and to understand in a different manner that will be divided by ABCD. So we will divide the lab values in ABCD. Just check on that. So this is very important one. nclex priority level means you are dividing lab values in 4 parts. That is A, B, C and D. A means low priority. What should be the nursing action? Continue monitoring. You have to monitor the patient, nothing to do. No action is needed over here. B is moderate concern. So what should be the nursing action? Assess and monitor closely. Being nurse, it's our responsibility to assess, to evaluate and to teach. So the B is moderate concern. Assess and monitor closely. You just need to assess the patient and monitor closely for further any complications in section B. And C, of course, we have to be very careful about C and D. C is critical. It means the condition of the patient is critical. You need to do 4 things over here. Hold if patient is having any drug or on some therapy, hold it. Assess the condition of the patient for further complication. Prepare for an emergency action. Emergency action means, for example, patient has high potassium and he was on potassium, IV potassium therapy. Just to stop the drug, assess for cardiac monitoring. ECG monitor should be placed. Just to check that there is no dysarrhythmias. Then lastly, notify the physician or doctor for further action. And the last one is D. That is the most concern. It is an emergency. So when it is an emergency, there is nothing to hold. Stay with the patient. Call the physicians. Don't leave the patient alone. Just ask someone to call the physician or prepare for emergency action. So if you remember this one table, it is very easy to recognize the most dangerous condition which the patient is suffering from. Then next, whenever you see an abnormal lab value, ask yourself, these 3 steps are important. Step 1 is this dangerous? Ask yourself, if potassium is 6.5, is this dangerous? Then what organ is affected? Yes, 6.5 potassium is dangerous. What organ can be affected? Of course, heart. So can this patient die soon? Of course, if no action will be taken, the patient will die with cardiac arrest. So these 3 steps are very important before starting the next step. So nclex doesn't care that you know the normal value. nclex cares whether the patient is safe. Remember, the nclex is not checking our memory, like status, our knowledge and everything. They are checking our critical thinking, our decision making. That is the most important, that can help us to save the patient. So safety is the priority. For example, potassium is 5.8. Instead of thinking normal is 3.5 to 5.0, we are thinking that potassium is normal value is this. We are remembering calcium is this, sodium is normal value is this and that, etc. But think high potassium can stop the heart. That is priority. So we should need to know the rationale behind the abnormal lab value. So that is the priority by the nurse. Always remember this. Think what will kill first. When we talk about the lab values, we need to know that what will kill first. What is the most dangerous? Easy memory trick. Potassium kills heart, sodium kills the brain, hemoglobin kills oxygen delivery. Then platelet kills through bleeding. Low platelets leads to bleeding. Calcium kills through tetany or dysarrhythmias. That also related to the heart muscles. Now we going to start the main concept of NCLEX that really help us to pass the exam. That is ABCD. How lab values divided under ABCD. From the very first, lab values start from serum creatinine. So serum creatinine is telling us the kidney function. If creatinine level is more than normal, so it's under A, means lower priority. Nothing to do, just assess kidney function, not an emergency. Tell provider before IV contrast dye. Just let the anyone who is taking care of the patient for doing any IV contrast dye, tell about the abnormal kidney function. Then second is INR. INR means International